talk about a couple of alternatives to banding for internal hemorrhoids. So there are two alternatives that can be done in office in order of invasiveness. In general, sclerotherapy is least invasive, followed by infrared coagulation. Banding is the most invasive of office procedures that are non-surgical that we can offer patients. So let me explain what both of these other alternatives are, as most people are aware of bands, but most practices don't offer these other treatments. So anytime a patient comes to the office for management of internal hemorrhoids, we always have to do an anoscopy exam. And that is using a scope like this that after we lubricate, we will insert in office to take a look at the hemorrhoids inside. So once we do that, we can kind of see if a hemorrhoid is protruding internally through this little slot. And then if we're gonna do an injection, we'll generally do the injection, which is sclerotherapy using alcohol and olive oil, where we insert the needle through this long scope. This is why the needle is long. And then in here, in order to inject an internal hemorrhoids, this is generally painless. It's not discomfortless. It's uncomfortable to have a scope in there, but for people that are suffering from hemorrhoids, either they're bleeding or protruding, this can absolutely be very helpful with little to no downtime at all. People can return to their normal activity that same day. The other treatment is infrared coagulation. And infrared coagulation uses a little gun that looks like this. And same thing, we insert this through this scope into the anus, where we apply heat, infrared energy to the hemorrhoid in order to cause scarring and cause the hemorrhoid to shrink down. These procedures actually reverse the hemorrhoids by causing pressure and scarring over the hemorrhoidal veins, which allows the blood to reroute. For individuals that do not respond to these office treatments, the next step is surgical management. If there's any questions I can answer about non-surgical management of hemorrhoids in office.